This video highlights important information from one of the articles in the module dealing with ethical issues with children and family. This is a discussion of the Pate 2013 article, Assent and Dissent in Pediatric Progressive and Critical Care. Make certain that you also review the video dealing with the Tillett article, dealing with adolescence and informed consent, and also the Harrison article entitled The Offer They Can't Refuse. In all aspects of health care, children are considered to be a vulnerable population because of the extreme power imbalance between the adult, provider, and the child. This always places the child at a distinct disadvantage and results in the child being much more susceptible to possible victimization. But another critical consideration involves the reduced decisional capacity of the child. The immature developmental level of the child is also a significant consideration. The child does not have the awareness of possible future implications to be fully capable of decisional capacity. And in addition, the lower developmental level of the child renders him much more vulnerable to possibly being exploited. Because children can be potentially made to do something, made to participate, the goal in healthcare for the most ethical care is to involve the child in as many decision-making activities as often as possible, and Pate identifies the ethical basis for that involvement. Respect for the child's autonomy and freedom to choose is a measure of respect for his humanity and individuality, and failure to respect his autonomy is in essence disrespect for the child as an individual. Involving the child as much as possible in a therapeutic way increases beneficence for the child and also for the provider, because involvement results in greater cooperation and increased active participation in the proposed treatment plan. Involving the child as much as possible is a strategy to minimize harm to the child because it reduces the surprise aspect of healthcare procedures and decreases the usual response of "no, I don't want to every activity. And involving the child is also a measure of justice. The child is treated fairly and respectively so that the child has knowledge and awareness of future events or planned activities that distinctly affect him individually. A key discussion in Pate's article is the distinction between consent, as understood with adults, and assent, as understood with children. And there is a distinctive legal and ethical difference in informed consent, as understood with an adult, and assent, as it is understood with a child. Informed consent is understood legally to apply only to adults or emancipated adolescents. And we've previously discussed that informed consent involves the individual having decisional capacity. Some states do specify criteria for legitimate times when informed consent by a child, especially an adolescent, is acceptable. But generally, informed consent only applies to adults. Assent is legally and ethically understood to apply to children and is in essence a sense of agreement on the part of the child to participate in a treatment or procedure. Assent indicates a level of involvement in the decision-making process, but a child's assent must always be associated with a legal parental or guardian consent. Obtaining assent from the child involves the child in the decision-making process and allows a degree of control over events in his own life. Pate also discusses the idea of dissent from a child. Dissent is the choice of the child to decline or refuse to participate in an activity or procedure after learning the details and expected outcomes of that procedure. This is always a challenge when the child absolutely dissents. This may be a time issue, and the provider may wait for the child to process the information or wait until the child feels differently. Even if the provider is able to delay a treatment or a procedure in some situations, there are times in which the well-being of the child dictates that one proceeds even if the child continues to refuse. In those situations, most agencies have specific restraint protocol in which there will be brief holding or restraining for a procedure within agency guidelines. The situation may best be handled by delaying the procedure until a more opportune time. But there are frequently situations in which the parent or provider is required to engage the child in forced treatment when it is considered medically necessary. And Pate emphasizes that when mandatory restraint and proceeding is required, the provider should complete the procedure quickly and professionally, and then apologize to the child and to the parent for the forced interventions. Pate summarizes guidelines and recommendations to minimize ethical dilemmas when providing care for children, and it is important to understand that guidelines for involving children in planning their care do vary by state and by the type of agency. It may also vary by the type of medical diagnoses and the own parent's preferences. The key is always to consider the beneficence of the child. The greatest benefit comes to the child when the provider explains what is medically recommended and what are considered to be the anticipated outcomes, benefits, and burdens. The key, when there are no absolute rules, or when the rules do vary by state or by agency, is to employ all possible strategies to encourage a buy-in, support for the recommended procedure by the child, and then to be very patient to allow for that emotional processing that the child needs. The discussion with the child and with the parent should be done in a partnership type environment. The key in your preparation for Exam 3 concerning the Pate article is to understand the difference between consent and assent, to know what the responsibility of the provider is when obtaining assent from the child, what the responsibility of the provider is when the child does offer a valid dissent, and the responsibility of the provider when it is required to proceed without assent. This concludes the video dealing with the Pate 2013 article on assent and dissent.